So neck region we are going to start after the completion of lower limb, and we are going to proceed for that is the neck region. So it is very important, questions are asked, long questions in the neck region. Okay. So in this you are going to, when you see the structure of the neck region, from the superficial to the deeper side we go. When we see on the side view of the neck also we can present, as well as when we go to the front to the back or deeper to the neck region. So when you dissect or when you see the neck region, you are going to see the following structures from the superficial to the deeper one. It is very important to know what are the important structures in the neck region, because what are the structure we are going to study under the neck region, you are going to understand. When we go from anterior to the deeper one or the superficial to the deeper one, you are going to get the following structures. So following structures, as you see the front, we have the skin. Next, deeper to that superficial fascia we are going to get. Then we are going to have the one muscle known as the platysma, which is we are going to get, and we have the deep fascia. Means what? Skin, superficial fascia and deep fascia. Then we have the one thin muscle which is covers the neck, very important muscle, that is which we call as the platysma. Next comes about after the deep fascia, we have in the deep fascia different pretracheal, paratracheal. We are going to get the different prevertebral. These are the fascias which we are going to get in the deep fascia. Then I have told the very thin muscle which covers the neck region. Almost all the neck region which is covers, that we call as the platysma. Then deeper when you go, we are going to see the muscles. Small belly having the muscles which we are going to get in the neck region. And these muscular spaces which is bounded by the different muscles, those we divide into a triangular in shape. We can divide this into an anterior triangle and posterior triangle. Means small muscles which are having in the neck region, they have the triangular spaces. How we have come across the triangular muscular spaces like femoral triangle, popliteal fossa, vital fossa, and we are dealing now in the neck region. So it is very important to deal the structures from the superficial to the deeper when we are reached till the muscles. So also we have in the superficial fascia, we have the superficial veins, superficial lymphatics, lymph nodes, all they are the content which we are going to get in the superficial fascia of the neck region. So lymph nodes and lymphatics. Okay. Then deeper to that I have talking about the muscles of the neck region. One most important muscle we get in the neck region, that is the sternocleidomastoid muscle or the sternomastoid muscle. So this muscle is important, and this is the only which is we are going to get comparing to the neck region is an important and bigger one comparing to the other one. So that these muscles, we have in the deeper one, we have the one deep gland which is we are going to get in the neck region. We get the thyroid gland, very important gland which is clasping the upper part of the trachea, that is the thyroid gland. And in the below the mandible, base of the mandible, we have the one more gland, that is salivary gland, which is a submandibular salivary gland. Two glands which are present in that is the neck region, that is we get the thyroid and submandibular salivary gland. Then again deeper you go, you are going to get the great vessels. We are going to get common carotid, internal carotid, external carotid, internal jugular, nerve like a vagus nerve, important vagus nerve coming from the brain to the reaching to the abdomen. That is we are going to get the vagus nerve passing from the neck region. Then again deeper you go, you have the trachea. More deeper you go, esophagus. So these are the structure from the superficial to we are reaching to the deeper one, that is till the esophagus. So it is very important to understand these are the topics which remains to teach you in the neck region. So I have told the skin, superficial fascia, deep fascia. In the superficial fascia, I have told the prevertebral, pretracheal, paratracheal, prevertebral fascias. Then we told the platysma muscle. Then again we go to the deeper two glands, which is we get the thyroid and submandibular salivary gland. Then again deeper when you go, you are going to get that is a trachea and esophagus. Meanwhile, when we get the group of muscles, neck muscles, then again we are going to deal the superficial veins, deep veins, superficial vessels, deep vessels, and so this is all about the introduction to the neck region, and in that we have studied what are the structures of the neck region. Okay, so going to the first my topic in the neck region is that there is a triangles of neck. What are these are the muscular triangular spaces which are present in the neck region, and those we are going to call as that is the triangles of the neck. So when you see the outline of the neck region, when you see the outline, you are going to get that is in this you are going to see outline that will be. When you see outline of the neck region on the side view, not anterior view, when you see the lateral side of the neck region, you are going to get lateral side of the neck region is a quadrilateral in outline. So this is a very important to remember, the lateral side of the neck region having the quadrilateral outline, and this quadrilateral outline which is having the boundaries. So now I am talking about what is the boundaries for the quadrilateral space or the quadrilateral boundaries of the neck region. Or the side view of the neck appears like a quadrilateral, and what are the boundaries of the quadrilateral space or the quadrilateral outline of the neck. So I am not talking about the boundaries of the triangles of the neck. I am talking about the primary stage, which is, you can remember, the outline of the boundaries of the quadrilateral space of the neck. So it is bounded anteriorly by the anterior median plane or the anterior median line, which is extending from the mentum to the sternum, manubrium sterni. So this is the midline, which is a median plane, or the midline, which is we are going to get, it is bounded anteriorly. Superiorly, it is bounded by the base of the mandible, and line joining the angle of mandible to this is a mastoid process, and this mastoid process to the superior nuchal line. Very important, you have to tell the base of the mandible, then you have to tell the line joining the angle of mandible to the mastoid process, then superior nuchal line. So this is the one which is you have to remember about boundaries of the quadrilateral space of the neck superiorly. Then posteriorly you have the anterior border of the trapezius, and inferiorly you have the clavicle. Anteriorly, anterior median line, superiorly base of the mandible, and a line joining the angle of mandible to the mastoid process. Then it is reaching to the up to the till the superior nuchal line superiorly. Posteriorly, anterior border of the trapezius, inferiorly clavicle. Okay, this is the quadrilateral space of the neck boundaries. This quadrilateral space of the neck is obliquely divided by the one main muscle of the neck is the sternocleidomastoid. This sternocleidomastoid extending from the sternum to the insertion to the mastoid. Name itself gives its origin insertion. Very important to remember, sternocleidomastoid. Sternal head from sternum. Cleido is a clavicular head. Two heads it is having, sternal and clavicular head. So that it is named sternocleido. Then it is inserting at the mastoid process. So that sternocleidomastoid. Origin of two part, insertion one point. That is all in the name of the muscle. That may we call short form sternomastoid. Sternocleidomastoid is a complete, but you can use the sternomastoid, which is you can use. So what I am talking, Quadrilateral space of the neck region is divided obliquely by the important muscle of the neck, that is the sternocleidomastoid muscle. And this sternocleidomastoid muscle divides the quadrilateral space into an anterior part and posterior part. The space which is present, muscular space in front of the sternocleidomastoid, is called as the anterior triangle of neck. The area behind the sternocleidomastoid is called as the posterior triangle of neck. So you have to remember how the directly question can be asked, one, anterior triangle of neck or the posterior triangle of neck. So you have to remember the anterior triangle is how and posterior triangle is what. So first one, you have to deal the first quadrilateral space boundaries and obliquely by the sternocleidomastoid muscle. Then you have to explain the anterior triangle and posterior triangle. So now today I am going to talk about deal about the anterior triangle of the neck region. So what is the definition? You have to tell first definition, what are the boundaries, what are the subdivisions, then again more detail of the subtriangles we have to deal. Okay, so anterior triangle I am going to deal. What is the definition of the anterior triangle? You have to know the area which is in front, anterior triangle, area behind, posterior triangle. Here when you see front view, you are going to get the both the sides of the anterior triangle which is lies in front of the both the sides of the sternocleidomastoid in the neck. Both the sides sternocleidomastoid is there. Within that in front part we are going to call as the right and left sternocleidomastoid. In front part will be the we are going to call as an anterior triangle of neck. Then behind part we call as an posterior. So what is the anterior triangle of neck? You have to tell anterior triangle of neck is one of the important triangle of the neck muscular space which is situated in front of the sternocleidomastoid muscle. What is the definition? It is a triangular muscular space situated in front of the sternocleidomastoid muscle is called as an anterior triangle of the neck. Then posterior triangle, how? It is a triangular muscular space situated behind the sternocleidomastoid. Okay. Now we are going to concentrate on the anterior triangle of the neck, which is my lecture includes in this anterior triangle of the neck. Introductory part. So anterior triangle of neck, once again to deal definition, it is a triangular muscular space situated in front of the sternocleidomastoid is called as an anterior triangle of neck. Next, boundaries of the anterior triangle of neck. It is bounded anteriorly by the anterior median line or the median plane. I have already told it is extending from the mentum to the sternocleido, that is the sternum, manubrium sternum. Okay, that is the line. Posteriorly by the, and this is the anterior border of sternocleidomastoid, posterior border. So it is posteriorly bounded by the anterior border of the sternocleidomastoid muscle, and superiorly by the base of the mandible, line joining the angle. Here will come the angle of the mandible to the mastoid process, not superior nuchal line. Superior nuchal line goes to the posterior triangle. So when quadrilateral, you can include superior boundary, but in the anterior triangle, you have to explain till the mastoid process superiorly. So base of the mandible, line joining the angle of mandible to the mastoid process, that is the superior. Inferiorly, you can going to get as a apex, we call this apex which is lies on the sternum. Okay, this can be base, this is anterior boundary, this is a posterior boundary, and this is the apex of the anterior triangle of the neck. So anterior triangle bounded anteriorly, anterior median plane or line extending from the mentum to the sternum. Posteriorly it is bounded by the anterior border of sternocleidomastoid. Superiorly by the base of the mandible, line joining the angle of mandible to the mastoid process. Then apex lies at the sternum. Okay, so this is all about the boundaries of the anterior triangle of the neck. Next, this anterior triangle is divided by the two muscles into 4 subtriangles. Directly sometimes question is asked one triangle. So you have to remember about the more than important, that is which is you have to remember. This is we call as the anterior belly of digastric. Now you have to concentrate. Anterior belly of digastric. This is the posterior belly of digastric. So when you go to the posterior belly, here we are going to get anterior belly of digastric. This is a posterior belly of digastric. This is superior belly of omohyoid, inferior belly of omohyoid. So muscle name are different. You have to remember here. That is I am talking about the subtriangles of the anterior triangle. The anterior triangle is subdivided by the two muscles, that is anterior belly of digastric and superior belly of omohyoid muscle. These two muscles will divide the anterior triangle into a four subtriangle. What are those four subtriangles? We have the submental triangle. This is we get the submandibular. We are going to get this is the carotid triangle and this is a muscular triangle. We are going to get almost all these. So sternocleidomastoid, inferior belly. This is a diagram representation of the muscles identification. Previous diagram I have told this is a subdivisions of the, which is you are going to get in the triangles of subtriangles of the anterior triangle. So I have told submental triangle, then digastric. This is a digastric triangle. This is a carotid triangle and muscular. What are the four subtriangles of the region anterior triangle? Submental, digastric, carotid, and we have the muscular. So their names are given according to their contents. Means here you can see submental means below the mentum. This is the mentum. Then we have the digastric triangle below the submandibular region. Digastric muscles are boundary making, and that is a digastric triangle. This is a carotid triangle because it contains the common carotid, internal carotid, external carotid arteries of the neck. So that is a carotid triangle. Then here muscles are present on the anteriorly, which is we have the muscular triangle. Submental, digastric, carotid and muscular. So submental triangle, which is you are going to get the below the mentum. This is a mentum, below this on the median triangle on the extended neck. So this will be anterior triangle, which is consist of the four suprahyoid and four infrahyoid muscles. You have to remember there are important four. This is a hyoid bone. This is a hyoid bone. Okay, this is a hyoid bone. Here in the diagram you can see. The muscle which are present above the hyoid bone are the called as suprahyoid muscle. Muscle which are below attached below the hyoid bone are the infrahyoid muscle. We have the four suprahyoid muscle, four infrahyoid muscle. What are the four suprahyoid muscles? We have the digastric, we have the stylohyoid, mylohyoid and geniohyoid. Here suprahyoid muscle, one you can see here digastric, stylohyoid, mylohyoid and geniohyoid. Then infrahyoid muscles are the sternohyoid, sternothyroid, thyrohyoid and omohyoid. So infrahyoid muscles are the sternohyoid, sternothyroid, thyrohyoid and omohyoid. See, almost all these attached to the sternum to the hyoid, and thyroid cartilage or thyroid to the hyoid. Sternohyoid, sternothyroid, thyrohyoid and omohyoid. These all four muscles are we call as an infrahyoid muscle. Question may be asked in the MCQ. Name the all are the suprahyoid muscle except. All are the infrahyoid muscle except. That can be asked. One can be given to the alternately option for that. So this is all about the introduction of the quadrilateral space of the neck. Then I have told the anterior triangle of the neck, boundaries of the anterior triangle of the neck. Then I have told the subtriangles of the anterior triangle of neck. Then what are the suprahyoid muscles and infrahyoid muscle. So first triangle which is we are going to deal, that is a submental triangle. So see, regions were submental, here submandibular, here we have the carotid and we have the muscular. Muscular, carotid, submandibular or digastric or the submental. So digastric is present at the submandibular region. Submental region is a mentum below this is a mentum, below this is submental. And digastric triangle is a submandibular region, base of the mandible to the hyoid bone. This region will be the submandibular region. So submandibular region, the digastric triangle is present. Carotid contains the carotid artery and common carotid, internal carotid, external carotid artery. Muscular, this muscular triangle contains the infrahyoid muscles. I have just now told the infrahyoid muscle, sternoid, sternothyroid, thyroid and omohyoid. Those all are the contained in the muscular space. So this is all about the subtriangles of the neck. So after this we are going to deal about the one triangle, submental triangle. So submental triangle, when we see in the extended neck region, front view, when we see the extended neck region, you are going to see this is a hyoid bone. Okay, this is a hyoid bone. This is a median plane or median raphe. Then we are going to have this is the anterior belly of digastric and this is a posterior belly of digastric. Okay. So what? This is a median raphe, anterior belly of digastric and this is a posterior belly of digastric. And we are going to have the mylohyoid muscles which we are going to get in the, that is a floor. Like this way we are going to get mylohyoid muscle. So this which is you have to remember. Okay. So here also we are going to get according to the midline. So this is a triangle which is we are going to deal, that is a submental triangle. What you have to remember first? Submental triangle is a subtriangle of the anterior triangle of the neck, which is very well seen when we see the extended neck. Then it is present on the median line, on the both the side. In the midline it is present. So we are going to get the submental triangle below the mentum. What are the boundaries? On each side it is bounded by the anterior triangle, that is anterior belly of digastric. Both the side we are going to get on each side, which is going to call as an anterior belly of digastric. Base is formed by the hyoid bone. Apex lies at the chin. So we are going to get the one which is that is what is the definition I have told? Submental triangle, first triangle of the subtriangle of the anterior triangle. Submental triangle. It is present at the submental region. It is a median triangle. Midline it is situated. Right side, left side, half of you are going to get. And median triangle. This one bounded by the, we have on each side by the anterior belly of digastric muscle. This is anterior belly of right side and left side we are going to get anterior belly of digastric muscle. Base is from the hyoid bone. And apex lies at the, we are going to get at the chin. Okay, this is a boundary. And floor is formed by the right and left side of the mylohyoid muscle. I have told one of the deep muscle in the infrahyoid muscle, mylohyoid muscle, and we have the median raphe. What is the meaning of raphe? Raphe is two parts, right and left. They meet in a midline of the body. That is we call as a median raphe. So this median raphe and mylohyoid are the making the floor of the submental triangle. So I have told the submental triangle is a subtriangle of the anterior triangle of neck. Then I have told its boundaries. I am talking about the floor. Is it clear? Then what it contains? So when you go to the contents of this, you are going to have the small submental lymph nodes. We are going to get the both the side, which is you are going to get, that is a small 2 to 4 or 3 to 4 small submental lymph nodes. Very easy. Contents are the small 2 to 4 small submental lymph nodes. What is this draining area of this submental lymph nodes? Whenever you get the injury or infection to the area, you are going to get the submental region, lymph nodes are enlarged. So here small 2 to 4 small submental lymph nodes are the main content of the submental triangle. What is the draining area of these lymph nodes? The lymph node The superficial tissue below the submental region means this superficial tissue, skin of this all submental region. The superficial tissue below the submental region. Second one, draining area is what? Lower lip, central part of the lower lip. Then we have the adjoining gum, then tip of the tongue and anterior part of the floor of the mouth. So see, any tip of the tongue, any ulceration injury, you will next day you will get the enlargement of the submental. Anterior part of the floor of the mouth, there also it is a draining area. So draining area where it is causing any ulceration, injury, infection, that time these lymph nodes are enlarged. So you have to remember this submental triangle contains about 2 to 4 small submental lymph nodes. And these submental lymph nodes draining area are the superficial tissue below the submental region. Superficial tissue means we have the skin, superficial fascia, deep fascia. Then next I have told the central part of the lower lip. Then I have told the adjoining gum. Gum means below this, which is a teeth, which is we are going to get, that is a gum. Adjoining gum. Then tip of the tongue and floor of the mouth, anterior part. So this area will be drained by the small submental lymph node. And the second content, you have the small submental veins are present, small submental veins, and they will join and forms the anterior jugular vein. So content of the submental triangle are 2 to 4 small submental lymph nodes and small submental veins, and they joins to form the anterior jugular vein. So these are the two contents of the anterior triangle that is in that submental triangle. So this is all about the I have dealt the anterior triangle, quadrilateral space, anterior triangle subdivision, what are the suprayoid, infrayoid muscle. Then one triangle out of 4 subtriangles of anterior triangle, submental, digastric, carotid and muscular. In that I have dealt the submental triangle. So this is, you have to remember about the total anterior triangle of the neck. Okay. So this is all about the today's lecture, which is covers the anterior triangle of neck. In that first triangle, submental. Okay. Write down.